There we go. Alrighty, well, thank you so much, my friends, for joining us here on another episode of Extreme Health Radio. Let me turn the old music down here really quick so it's not too loud. Hope you guys are having a great Wednesday afternoon or morning, wherever you are in the world. I appreciate it. It's good to be back, actually. We had about a week off that I just took off. I was a little bit under the weather, and so I had to do some natural therapies and some things. High-dose vitamin C I did some IV vitamin C, did all kinds of cool things, but I had a little 3-day deal going on, so I got over that. So it's really good to be back. I'm super happy about this and today's show. So if you guys are new to the show, we do broadcast 3 days a week on Monday, Wednesday, Friday at 10:45 a.m. Pacific time. So if you want to join the live show and become a part of the chat room, ask your questions to our guests, there's links for that on Extreme Health Radio on the homepage there. So make sure to check that out. And let's see here. What else? Oh, yeah, this is episode 657. So if you want to grab the show notes, if you're listening on a podcast years down the line and you want to get access to the show links or anything like that, just go to extremehealthradio.com/657 and you can get access to all the show notes and all that good stuff. So let me bring up our upcoming guest schedule because we've got a lot of really cool guests coming up here. So those that are watching live can see here. So on Friday, we have Dr. Judy Mikovits, and we got turned on to her from our good friend Zirin Kenny, and he's been on the show twice now talking about Lyme disease, and he referenced her work quite extensively. But we're going to be talking about cannabis and healing on Friday, February 22nd, and then on Monday, we have Professor Emeritus Garth Nicholson, and we're going to be talking with him about mitochondrial and chronic diseases. So that's going to be really, really cool. I was hoping to have the in-studio mics ready for him, but they're not ready yet. So that's going to be happening on next Monday. And then next Wednesday, a week from today, we're going to have Judy Seeger, and we'll be talking about how to detox cancer. That's what she put up on the show title there. And then next Friday, we have Angel Hawerton, and we'll be talking with her about her cancer journey. Geez, talk about quite an extensive cancer journey. That's going to be a crazy, crazy show. She had, her body had, I think, ovarian cancer, and it was really serious. So that's going to be a really fun show. So if you haven't subscribed, if you're watching on YouTube, make sure to subscribe. If you haven't subscribed on iTunes, make sure to subscribe. That way you don't miss any of these cool shows coming up. And it's a lot of fun. We love to interact with you guys in the chat room. And it's a lot of fun. So today, this is going to be a really cool show. We have Sarah Hornsby on the show, and we've been following her for a while on Instagram. And then I found out subsequently that she was following us, and maybe she was familiar with our show. But we're going to be talking about her work and about her website's called myfaceology.com, and we're going to talk about the facial structure, mouth breathing, sleep apnea, all these kinds of things that we think are just sort of irrelevant or don't mean much, and how they integrate into our health. And she's a graduate of Eastern Washington University with a bachelor's degree in dental hygiene, but for a number of years now, she's been working with patients around the world with their work on myofunctional therapies and things. So let me bring her on the show. Sarah, thanks so much for being on.
Hello, thanks for having me.
Yeah. I was surprised when you were following us when I reached out to you on Instagram, and because we've been following your work for some time.
Oh, I think it's funnier that you were following me, so I don't know. I'm glad you reached out though. I think that's awesome.
Yeah, we had, I think we've only done one other show on this type of work, and it was with a woman by the name of Carol Vandersteep, I think. Vanderstoop.
Oh
And
yeah, I know her.
yeah,
Yeah.
and we did a show years ago, but it was so fascinating to me, this whole subject, like how your facial structure
Yeah.
impacts your health, and, looking at your work and your website, you have all these articles on these subjects that they almost seem like things that people just don't even think about, right? It's kind of bizarre.
Yeah, they seem, I mean, really, I always tell people it's common sense. What I do isn't like that. I mean, it's a really big deal in some ways, but it's also just the way that we're meant to be. I help people learn to breathe through their nose, keep their lips together, swallow correctly, and keep their tongue in their palate. That's like the core foundational stuff of what I teach.
Hmm.
And those are things we shouldn't need a therapist for. Those are things we should do naturally. So
Right.
if we're not doing those things, then to me that tells me there's signs of dysfunction and problems. So
Hmm. Hmm. Yeah, it's fascinating, and how it relates to overall health too is fascinating too. So I want to get into all of this stuff because it's really fascinating to me. And I was telling you before the show that I've got a whole bunch of questions, like I do for every
cool.
guest, lined up. But generally, I just kind of go where the conversation goes. So first, before
Perfect.
we even really kind of start and get into all of this stuff, so you started out in dental hygiene, right? And then how did that shift start happening for you when you first started?
It's kind of a long story, but I guess to summarize it, I found out pretty quickly as a hygienist that I loved working with patients and I loved, kind of the educational side of things. But the job itself, I just couldn't envision doing for like the next 30 years. So
Hmm.
pretty quickly out of dental hygiene school, I think I was only a year out practicing hygiene, and I was already thinking like, maybe I should go to dental school, maybe I should get an MBA, maybe I should, do something else because I just don't see this as a future for me. And, that's kind of a difficult pill to swallow when you've just gone through. I mean, I was in school for 5 years and I, had student loan debt, and I just thought I can't give up on dental hygiene. So eventually, I mean, it was a fluke coincidence, and now maybe it's, you could call it like it was meant to be.
Hmm.
But I started off I was reading a dental hygiene magazine. I was looking for CE courses I could take to kind of fulfill my credits that I needed to renew my license. And I found a course on myofunctional therapy, and it said, take this training and change your dental hygiene career. And I thought, well, I've never heard of this, so maybe it's like a scam. Maybe, I mean, maybe it's not real, but I've got to try it. So I paid the money, I went to the course, and when I was sitting there in the course, I think, I didn't fully believe that this was a whole segment of dentistry and healthcare that was existing that I had never heard of,
Hmm.
except that I had the symptoms myself. And
Ah.
so I was sitting there thinking about my tongue posture and my breathing and thinking about, I was a kid with allergies, and I was thinking, well, this is me. And I was super confused. I thought, I kind of felt in denial
Hmm.
because I thought, well, I have this degree in dental hygiene and I've never worked for any dentist. I've never met a dentist or an orthodontist who's ever talked about this stuff. So maybe this is a scam. I still kind of felt like that,
Hmm.
except I dug a little deeper and I kept going down that road because I recognized the symptoms in myself. And some part of me was thinking, if I have this and I'm a hygienist and like this is my realm, the mouth and the oral cavity, then other people must have this. And it seems like a really big deal. It seems
Hmm.
really important. So I guess I should pursue it. So I did.
Hmm. Yeah. So when you pursued it, did people think you're crazy, like your colleagues and things? They must have.
It was a rough road, honestly. I mean, that's interesting that you talk about having Carolyn Vanderstoop on a few years ago because
Mm.
the field has changed dramatically in, the relatively short time that I've been doing myofunctional therapy, which is almost 10 years. I feel like it's come so far. I mean, in a 10-year span, we've gotten so much more research on sleep apnea and the connections that people have. I mean,
Hmm.
basically, if you have sleep apnea, you also have these myofunctional disorders that I treat. So, mouth breathing is kind of the root cause of sleep apnea,
Hmm.
or tongue ties can be the root cause of sleep apnea. And that is something that we're not really good at in, modern medicine and dentistry, is like finding root causes.
Hmm.
So I feel like for a long time this was overlooked, but now we have research, and that's usually what gets people's attention, is like,
Hmm.
oh, some studies have come out, but they're only from like 2012, 13, 14, 15. They're
Really?
all very new. So
Yeah.
yeah.
Yeah, that's interesting how new
Mhm.
they are, and this is
Super
something that,
new. Hmm.
yeah. So with sleep apnea, we've done a few shows on Buteyko breathing and things like that, and I know that's something
Oh,
that you
cool.
are familiar with. So with sleep
Yeah.
apnea, let's talk a little bit about that because it's first of all, do we know how many people are diagnosed with
Uh,
sleep apnea? It's got to be a lot,
I
right?
don't know off the top of my head, but yeah, it's a lot.
Uh-huh.
I think, I mean, if you look at the risk factors for sleep apnea, they overlap significantly with the risk factors or the health symptoms that people that I treat have. So allergies, deviated septums, they usually connect sleep apnea back to breathing issues.
Mm-hmm.
So, and people that I see also have breathing issues. So I don't know the exact numbers. I
Oh
mean,
my
I'm
gosh.
sure if you Google it, you can
I
Google it, you could pull it up, but it's like
check this out. I just
millions and
found it. I'll
millions.
bring it up on the screen. This is absolutely
Mhm.
crazy. Tell me if you can see this. So I just pulled it up on Google. I just typed in how many
Oh,
people
yep.
diagnosed with sleep apnea. It's 22 million.
Yeah, it's a lot.
Wow.
I know, and most are undiagnosed. They say 80% of cases are undiagnosed. So if 22 million are diagnosed, I mean, what does that mean?
Mm-hmm.
That's insane. So,
Wow.
and sleep apnea is really such a quality of life thing. If you don't sleep well, your body doesn't get a chance to regenerate. You don't get, in growing kids, oh my gosh, the repercussions of not sleeping well affect growth in so many ways.
Mm-hmm.
It's really scary when we look at the number of kids who actually have sleep apnea and we don't know it. The
Mm.
symptoms of kids who have sleep disordered breathing or sleep apnea look very similar to the same symptoms that kids have when they're diagnosed with ADHD or ADD.
Oh,
So
really? Wow.
yeah, because when kids are tired, they get crazy. They get like
Yeah.
hyperactive. They have trouble sitting still. And I'm not saying like there's no such thing as ADD or ADHD,
Right,
but
right.
a lot of kids who get diagnosed with that actually have sleep disordered breathing. So that's a big deal.
Yeah, it's 22 million, and then kids, and then that's only counting the diagnosis. And then, like,
Diagnosed.
we
Yeah.
have a friend of the family, a friend of my wife's who died as a result of sleep apnea. And,
Yeah, I hear stories like that all the time. I don't know anyone personally, luckily,
mm-hmm.
but I mean, most of the patients that I see in my practice today are adults, and I would say most of them are in their 40s and 50s, and
Mm-hmm.
most of them have some type of sleep disordered breathing and some degree of pain. So, like TMJ pain, neck
Mm-hmm.
and shoulder pain, chronic headaches. That's kind of who I see now. When I first started doing therapy, my practice was very much focused on kids and orthodontic treatment. And
Mm-hmm.
so it's really the habits are the same, but the symptoms over a short term versus long term manifest very differently. So it definitely is a chronic problem.
So is mouth breathing the sort of only and number one cause of sleep apnea, or are there lots of factors going on there?
Well, it starts, I mean, this is kind of complicated. I don't know that the mainstream view of sleep apnea is that it starts with mouth breathing.
Mm-hmm.
I know that people in my field understand this, but my field is pretty small and pretty, new in terms of like what's happening. But there's really kind of a double whammy, I guess you could say. So if you're a child breathing through your mouth or a child who's tongue tied, you end up with compromised jaw development because if your mouth is open, your tongue isn't up in your palate to help guide forward growth and the width of the palate that we need. I mean, really, the tongue shapes the face as we grow. So if your mouth is open, your jaws will not grow forward, they'll grow down. So
Mm-hmm.
that's the first problem is if you're mouth breathing or if you're tongue tied, you have a compromised like jaw structure as an adult.
Okay.
If you don't correct these habits when you're young. The second problem is the tongue. So if your tongue is not making full palatal contact, it will drop to the bottom. And then when you sleep, your tongue is more likely to obstruct your airway. So you've got a soft tissue problem and you've got a structural problem. And, people who have these structural small jaws, narrow palates, small mouths, they also have small airways. So it's a whole mix of problems, but basically if we could guide kids growth we could avoid sleep apnea completely.
Hmm. And then if you think about it too, the small mouth is probably related to not having a palate that is amenable, I would say, to all of their teeth. And then you start having crooked teeth, and then you have to
Exactly.
go to an orthodontist,
Mhm.
and it kind of just
Totally.
snowballs, doesn't it?
It does. And, I do have parents ask me all the time, like, if we do this therapy, can we prevent, can we avoid getting braces for our kids?
Hmm.
And I'm like, well, I mean, it depends. If you start looking at this stuff, like if you notice that your 18-month-old is mouth breathing or tongue tied, then you can know that, okay, we've got to help them as early as possible. But
Hmm.
if you notice that in your 8-year-old or 9-year-old, they've had 8 or 9 years of basically suboptimal growth and development of their jaws. So,
Hmm.
in my opinion, you've got to get the orthodontic treatment more than ever to help that just get them to where their potential is for their jaw development and structural development.
Hmm.
So, I'd love to say, yeah, do this therapy and you can avoid braces. But in reality, the people like me who need this therapy also need some structural changes,
Hmm.
to make space for the tongue and to make a bigger airway and stuff like that.
Hmm. Yeah, I mean, it's fascinating, this whole field, because if you think about the cascading effects, I mean, if you think about like
Yeah.
not having a mouth that's wide enough for all your teeth, and then you have to get braces. And then what I don't find a lot of people talking about is this correlation these days with 5G wireless technology and metal braces, because metal is a conduit for
Oh my
electricity,
gosh.
and
Yeah.
so like, so there's that, and then there's the fact that you're, getting your teeth misaligned. And I had, when I, before I started getting into this alternative health field, I had my four wisdom teeth taken out, probably because of all of a
Yeah.
lifetime of, not living properly. And then they were
Yeah.
taken out, and there's four cavitations that I had to have fixed because they were infected.
Oh, you did.
And
Wow.
so like it's just, and then the role that our oral health plays on our systemic overall health is there too.
Oh
And
my gosh. It's all
it's like,
so big. Yeah. And our oral microbiome is connected to our gut microbiome. And so
hmm,
people who mouth breathe, that bacteria, it changes. When the mouth dries out, when the mouth is an open environment versus a closed environment, now different bacteria thrive. So people who mouth breathe are more susceptible to periodontal disease and tooth decay and a
hmm,
lot of problems. So, it's just interesting that such a small, simple thing, like who cares if your kids breathe through their mouths? But it
right.
really, it can cause like a lifetime of bigger problems. And so that's really the message that I try to get out there to parents, because we don't see these things in a 5-year-old. We just think, oh, it's a bad habit.
Mm.
But I can tell you from the patients that I work with in their 50s and 60s and even 30s and 40s. I work with lots of people who are young and have big problems too.
Hmm.
They're like, I wish my parents knew about this. I wish that my pediatrician and my orthodontist um, knew about this, then my health today as an adult would be different.
Hmm. Yeah, that's interesting you said that about the microbiome, because I've known about the microbiome in the
Mm-hmm.
mouth and the gut and the correlation there. But I'd always heard when you mouth breathe, your saliva tends to dry up. And then in your saliva
Totally.
is not just bacteria and things, but also immune system cells. And those cells don't get a chance
Mm.
to actually take care of the bacteria. But I never heard that your microbiome changes by mouth breathing. That's a new one for me.
Yeah, yeah, gosh, I'd have to go back to my dental hygiene school, like curriculum on like what the bacteria strains are. I haven't looked at that for a long time, but yeah, there are very specific bacteria that are associated with periodontal disease and causing tooth decay. And it does come down to the specific bacteria. I feel kind of lucky. I'm one of these people that, I do brush and floss my teeth, but I've never really had problems with either gum issues or dental issues. I meet people who are much better at flossing and brushing and doing everything the right way, and they have way more problems. But just, me being somebody without the certain bacteria that causes these problems, I'm lucky I don't have that. So it's not all about diet and home care, like brushing and flossing.
Hmm.
It really comes down to more than anything the bacteria, and then those things that we do obviously help or hinder. If we don't brush our teeth, you're more likely to have cavities, but
Hmm.
it's not 100% that.
So it sounds to me like if you want to take good care of your oral health, just in terms of like cavities and things like that, the
Hmm.
more you can keep your mouth closed, just for that reason alone, would be good, right?
Totally.
Okay.
Yeah, for sure. Hmm.
Yeah, so you want to keep your mouth closed and then as much as you possibly can. And so now the biggest issue with that is people will say, "Well, I can't keep my mouth closed because I
I
can't."
can't breathe through my nose.
I can't
Yeah.
breathe through my nose. That's the standard question you always get, right?
Exactly. Well, people always say that to me. They're like, well, I think this is impossible. So, I mean, there are some physical problems that can happen that would prevent somebody from being able to breathe through their nose. So,
Mm.
if you have really large tonsils and adenoids as a kid, it can make it, there's a lot of obstruction back in there. If you have a very deviated septum, or if you have nasal polyps, or, whatever, I mean, type of obstruction in your nasal passageways. That is a true problem. So I always tell people, let's get screened by an ENT if you're really concerned with it.
Mm-hmm.
But the thing is, with practice, your body will adapt. Our nasal passageways, when they're not used, they shrink over time, and it feels so difficult to breathe through your nose. And I remember having this as a personal experience. I mean, I felt like this is impossible. I'm never going to be able to do this.
Mm.
And after about a month of just consistently practicing, most people will get to a plateau and they're like, okay, this is easier, but it takes a lot of effort in the beginning. So
Mm-hmm.
I know you mentioned Buteyko breathing, and there's a guy named Patrick McEwen. I don't know if you've had him on or if you know who he is, but
Mm-hmm.
he's a friend of mine, and he's also a brilliant teacher and probably like the world leader in Buteyko breathing. He says if you can breathe through your nose for 1 minute, you can breathe through your nose for life. So that just tells you it just might take a little more practice,
Mm.
but you can do it.
Yeah, yeah, we had him on a little while ago, probably 6 months ago. Really nice guy, and I love
Oh,
what.
good. He's so nice.
Yeah, I know he's such a great guy, isn't he?
I really like him.
Yeah, he's really cool. And one of the things that I thought was fascinating, I'm not sure if it was on the show we did with him or the show with Carol Vanderstoop, but she was talking about the carbon dioxide when you breathe through your nose versus when you breathe through your
Mhm.
mouth, the carbon dioxide levels change. And she was talking about this is one of the reasons why I think she's correct about how the fastest way to change your blood alkalinity is through breathing and not necessarily eating
Definitely.
green foods. And she was saying that like it actually changes the gases in your blood and your body to uptake
Yeah,
oxygen, right? Is that correct?
it does. Yeah, it's called the Bohr effect. So it's basically like I don't remember the exact like science behind it, but as the blood pH changes from breathing through your mouth,
Hmm.
you build up extra CO2 in your blood, and then your body is not able to absorb the oxygen as well. So,
Hmm.
but yeah, if you look up the Bohr effect, it explains it really well, and it does, it really is a big difference between mouth breathing and nasal breathing. So it's not just like air is air; it doesn't matter how you breathe it.
Hmm.
It does change in our bodies depending on how we bring it in to our bodies. So, and I mean, I don't know if you've heard much about nasal nitric oxide, but that's a huge component to benefits of nasal breathing too. So, it's only made in our noses. It's a anti-inflammatory. I mean, it's a smooth muscle stimulator, I guess. They call it like an aerocrine molecule,
Hmm.
but it's really important for our bodies and especially our respiratory system. So you get it when you breathe through your nose, but you do not get nasal nitric oxide if you breathe through your mouth, and it's really important for us. So.
Wow, nasal nitric oxide. I never heard of that before.
Mhm.
Wow.
Yeah. Yeah, it's really helpful. So kids who do have large tonsils and adenoids, for me, I'm always if I can avoid it, I would rather avoid a surgery.
Mm.
I'm not like anti-surgery at all costs, but if kids can keep their tonsils and adenoids and we can get them breathing through their noses, nitric oxide can help. It can help reduce the inflammation of the tonsils and adenoids. So that's for me the first thing is when I know kids have this, inflammation. How do we just get their bodies to try to kind of take over
Hmm.
and get the tonsils to shrink naturally?
Hmm. Yeah, it's interesting because like your biggest objection, like we talked about before, is just people say, oh, I can't breathe out of my nose, and it's easier to breathe out of my mouth.
Mhm.
But then this is the sort of problem when it comes to the work that you do and the work that we promote too, is like this is a systemic problem that's going to affect your long-term health. And like, so
Yeah.
if you want to be able to breathe through your nose, then you actually have to work on reducing inflammation and changing your diet and changing your lifestyle. And for some
Yeah.
people,
You might.
it becomes too
Mhm.
much, right?
Yeah, it does. And, this is why I always tell people, it is easier to work with a therapist. And that's why I have a job, because these things are hard to change on your own. So
Hmm.
some people say, well, I found some exercises on YouTube and I found some exercises. Like, do you think those will help me? And I'm like, I'm sure those are great exercises, but if you don't have anyone, I mean, it's like working out with a physical therapist or a personal trainer,
Hmm.
to help you and almost be like an accountability person. Like, we've got our appointment. Here's your exercises you're supposed to be working on. So I tell people, it's not easy. It is work. It's a lot of work to change habits. But
Hmm.
we're going for long-term, big picture changes to overall health. It's not just like a magic bullet, like take this pill, you know, have this surgery. I wish it was that easy, but it's not. So.
Hmm. Now, how
Mhm.
is the work that you do, how does it correspond to our health? Like if you think about changing the gases and the pH of the blood, carrying nitric oxide in, being able to deliver
Mhm.
oxygen to cells, I mean, I would imagine that would have a long-term systemic impact with regards to disease prevention. You can probably go on and
I think so.
extrapolate, but we can't make
Totally.
claims here, but it's got to
No.
impact it, right?
Mhm. It does. And I think it reduces overall inflammation in your body. And we all know inflammation is a big problem. If you mouth breathe,
Hmm.
your body is in a state of fight or flight all
Hmm.
the time. So mouth breathing and anxiety are very connected.
Hmm.
Long-term anxiety eventually manifests as depression. So even on the mental health side of things, it's it's not good to breathe through your mouth. It's really not. So if you can change that habit, that's one part of it. A whole different component, which we haven't touched on too much, is that tongue posture. So
Hmm.
our tongue is very connected to. I don't know if you're familiar with anatomy trains, but they've got a great diagram of the tongue and how it's connected to the entire. Like, there's a deep front line of, it's a muscle chain, and it shows the tongue connected to the lungs, the diaphragm, the quads. I mean, it goes all the way down to the feet, and it's all through fascia, and it's this chain of muscles. And so your tongue posture affects your head and neck posture. It affects your ability to, have good body alignment. So if you're mouth breathing, you're going to have more of a forward head, rolled shoulders. If you're tongue tied, you're going to have tight fascia down the whole front of your, body. So it's there's a lot of things going on. Not
Hmm.
to mention the whole sleep aspect, or people with TMJ issues. If you have a low resting tongue, you're going to have problems with your TMJ or headaches at some point in your life. I can almost guarantee it. So.
Hmm. So, what do you mean exactly by tongue tied?
So, a tongue tie, the technical word you might hear is a restricted lingual frenum, or a tethered oral tissue. These are all terms in our field that we use. But we all have a frenum under our tongue. If you lift up your tongue, you can see a line of skin or tissue. That's normal. We all have that. For some people, though, they have a midline defect that's connected to, I mean, it's really complicated, but the MTHFR gene mutation
I've heard
is
about that.
responsible for like cleft palate, spina bifida, midline issues really, and tongue ties happen to
Interesting.
be a midline issue. So if you have that, it's a very minor kind of birth defect or genetic mutation, and that will physically prevent you from being able to use your tongue and rest your tongue the way you should.
Interesting. So your tongue is sort of tied down a little bit more. Is that kind of the idea? It's
Yes,
shortened.
exactly. Yeah, I don't have a tongue tie. I mean, if I lift up my tongue can fully reach. So you can kind of test on yourself. If you open wide, so,
Okay.
and then lift your tongue up, you should be able to touch the back of your top teeth. So, mhm.
The back of your.
If,
I
of your
see.
front teeth, yeah.
Oh,
So if your
that's
tongue only
easy.
goes up like halfway, then you're probably, or if your jaw has to close to meet to get the tongue to reach up. I mean, that's a simple way of testing, but really, I mean, functionally, your tongue should be able to rest fully across the whole top of your mouth. You should be able to use the tip of your tongue to reach the backside of all your last molars. Your tongue should have a certain range of motion, just to keep your mouth clean, to get food out and stuff. So
Right,
there's
right.
a range of issues that can come from tongue ties alone. But yeah, it's a big part of what I do. So this is one of these times where if someone's tongue tied, I always recommend surgery. But I recommend doing exercises like pre-op, post-op, and the surgery is more of a means to an end. It's not the whole point.
Mm.
So if that makes sense.
That's interesting. So I want to take a short break here in just a second. But before I do, I want you to sort of reiterate all the different aspects of the body that your tongue is tied to. You mentioned a few minutes ago about how it's connected to all these different organs and
Yeah,
all the way
if
down your
you
body.
so on my Instagram, I do have a picture of it, and this isn't something that I, invented. It's a dissection. It's a picture of the tongue, and if you look at all the little points on there, and it sounds kind of gross, but it's a cadaver dissection, and it shows the tongue being connected to the diaphragm and the lungs, all through. I don't know exactly in the they call it the deep front line. So,
Okay.
but the quads, like something in the knee capsule. My specialty, as you can tell, is not the anatomy of the body.
Right, right.
But check out that picture on Anatomy Trains, and if you can find it, it's on my Instagram. Like I said, I found it through someone else, and I thought, wow, that's amazing because it actually shows the tongue. So
That is really, really fascinating. Golly, good stuff. This is really
it's
good
really
stuff.
cool. Yeah.
Yeah, so I'll try to find that during the break, and also when we come back from the break too, I think what we'll do is maybe we'll take a few listener questions from the chat room. So if you're in the chat room
Awesome.
right now, make sure to type your questions in all caps. And when we get back, and I'm going to ask Sarah also about our kids. I'm assuming she's been seeing our kids, and our kids have pacifiers in their mouth. And I feel like every picture we post with those pacifiers, she's thinking something bad about it. So we'll talk about that in just a second. I wanted to tell you guys about some cool products that we highly recommend, and one of them is the Bellicon Rebounder. And I just got my brand new, what do you call these things? Little bungees. I'd had mine for about 8 years before, and I'd been jumping on mine for about 30 minutes a day, and I would say probably about on average 6 days a week. And it's one of my favorite exercises to do is jumping up and down on a rebounder, especially outside. And rebounding is incredible. I used to think it was like this thing that you would do, like, Farrah Fawcett in the 70s would wear leg warmers and jump up and down. And I don't know, I just wasn't into it. I was more into like lifting weights and surfing and stuff like that. But when I started understanding more about what it does, how it cleanses your lymphatic system, and there's no real exercise out there that does that, and then started understanding the tie-in from your lymphatic system all the way to cancer and other diseases, you start really realizing how important an exercise like this is. And we had a good friend, Ty Bollinger, on the show, and listen to what he had to say about rebounding. It's pretty cool.
What do you do to treat cancer? What do you do to prevent it? Rebounding is something that I try to do on a daily basis. A little mini trampoline for those people that aren't familiar with the term rebounding, but it's basically just jumping up and down on the little mini tramp. What that does is it stimulates the lymphatic system. Lymphatic system is one of our primary detoxification systems in our body, and most folks don't stimulate their lymph flow, and so the toxicity in their body builds up because their lymph is not stimulated. And the up-down motion on a rebounder stimulates the lymph flow better than just about any other exercise. So I do that almost on a daily, probably 5 days a week. I would say I average doing that.
Yeah, it's funny because Ty is a former sort of bodybuilder, and to imagine him jumping up and down on a rebounder is pretty funny. But it is one of the things. If you're watching our YouTube video, there's a picture of Kate jumping on ours when we first got it, and it's just a tremendous exercise, and I can't recommend it highly enough for all of you guys to consider bringing one of these into your home. And we had a really cool Dr. Lloyd Jenkins on the show, and he's from the Budwig Center out there in Spain, and Here's what he had to say about it. It's pretty cool. On the flip side of that, you have to have some sort of a way of mitigating the stress that's in our life, right? So you have to have some kind of exercise. What kind of exercises do you recommend there at the Budwick Center?
Well, every room is equipped with a rebounder or a mini trampoline. So we really believe in the little mini trampoline. I noticed you're advertising that just recently on your program. We feel that's one of the safest, most gentle and effective lymphatic cleansing things that people can do. They're not expensive really, and they can just do a few minutes, maybe 2 or 3 times a day. So lymphatic drainage using the rebounder is very important. Someone who has advanced cancer, we just have them mostly do the trampoline, and they can even sit on the trampoline if they have to and bounce up and down, but some kind of exercise to keep the lymph system moving, and so that they don't just, because if you don't do anything, your body just wears out. The body has to work, the heart has to pump.
So true. And I'm just a big fan of rebounding myself. Like I said, I do it every single day. It especially feels really good after a workout too, because you have all this lactic acid build up in your muscles and your joints and stuff, and you increase endorphins. I do it out in the sun, so I get the full spectrum biophotons, over 1,500 different frequencies that are coming from the sun, grounded to the earth, fresh air. I mean, nothing feels better than doing like a good rebounding session after a workout. So I would highly recommend. I love the Bellicons myself. Those are sort of my favorites. If you're worried about balance, they have little bars that you can hold on to. The legs fold, so you can fold it and put it underneath your bed. It's just really a great contraption. And so I highly recommend it. If you're watching on YouTube, there should be a link down below for you to check out the Bellicon. And then if you're listening on iTunes, if you go to extremehealthradio.com/657, we'll put a link there too. And then I want to tell you about our good friend Daniel Vitalis and some of his products that he has over at Surthrival. I'm a big fan of these products, man. These are just incredible. So check this out from Surthrival.
Scientific research is just now catching up to what we've known about reishi for centuries. This medicinal mushroom is a wellspring of immunity. A significant portion of our immune function is influenced by external factors like our environment, diet, and history of infections. Reishi is scientifically celebrated for its ability to stimulate compromised immune systems and reverse inflammation by promoting the development of white blood cells. In addition to its immune-boosting properties, reishi is a potent adaptogen that supports a healthy heart and circulatory system. Surthrival's dual extraction process concentrates all these benefits into every bottle. We use organically grown reishi, organic grape alcohol, and bottle our extracts in violet glass for maximum potency.
That's right. I love that stuff from Surthrival. Really cool. I just love supporting Daniel and his work. And he's just really cool. And reishi, chaga, those are known as sort of the king and queen of mushrooms. And we take them often, very often. And anytime we run out, we always buy more. And Daniel Vitalis is really doing great stuff. He does it in, it's like organic reishi. He does it in organic grape alcohol, and then he puts it in Myron glass, and he uses spring water, so it's a dual extraction, the reishi, so it has all of the terpenes and all of the long-chain sugars and all of the medicinal compounds that come from both the water extraction and the alcohol extraction combined together in one. So it's really cool. So I highly recommend checking out Surthrival. Go through our link if you would be so kind. That would help support the show that we do. And then here's a little clip from him on Colostrum, which is something that we also take on a daily basis. We just love supporting him and his work, and this Colostrum is amazing. Check this out.
Forget superfoods. Colostrum is mammals' first food. Containing the essential building blocks for growth, gut integrity, and immune health. Often referred to as liquid gold, colostrum is known to balance immune function, support digestive health, and increase endurance and lean muscle mass. Colostrum's naturally balanced and living nutrition, which supplies growth and immune factors, is a delicious dose of restoration that's easy to use in powder or capsule form. Clean, conscientious, tested antibiotic-free, and produced in a U.S. GMP certified facility, it's your first food for second chances.
I love that. It's your first food for second chances. We give this stuff to our kids. We add it to their milk, and we take it ourselves. I mean, it's just incredible stuff. And what's great about Colostrum is not only is it incredible for like building your immune system and modulating and regulating your immune system more so than almost anything else, but also it helps to make your gut less, I'm trying to think of the right word, less permeable. So if you have leaky gut or if you have any kinds of things like that, it helps to seal the gut. And so you have less of these inflammatory proteins entering the bloodstream, causing all kinds of like autoimmune issues and stuff like that. So it's really, really an awesome food, and it tastes great too. It tastes really, really amazing. So check out the Colostrum. He's got a bunch of products on his website. He's got the Shaga, a bunch of stuff that we didn't really mention here, but a lot of really cool stuff over there at surthrival.com. So if you want to support the show, you want to try out some Reishi or some Colostrum, or check out the Rebounder. All the links, if you guys are watching on YouTube, are down below. And let me bring Sarah back and turn her audio on. And I want to ask her, we'll jump around in the chat room. But Sarah, yeah. I wanted to ask you about our little twin boys who are 6 months old. And I got re-inspired to not have them use their pacifiers. So let's talk a little bit about that. How can we prevent them from using pacifiers?
It can be really tricky because, I mean, there is some degree of self-soothing that babies need. And, so I don't think, and I always try to like have this caveat, like I am not a mom, I'm not judging any parent because, right. I've never gone through it personally myself, but I do know a lot about oral development, and it all starts when we're babies, and it all starts with breastfeeding. We know that babies who are breastfed for longer periods of time develop wider palates. And we actually have, I think there's one study talking about breastfed babies are less likely to have sleep apnea. So that's kind of cool. But yeah, the pacifiers, I think it all comes down to intensity, duration, and frequency. So if they're using it once in a while for not that long, and then it comes out and, their mouths close and they're breathing through their nose, then I think it's okay. I think after, how old are they?
They're about 7 months. So going to be 8 months.
Okay, I was gonna guess 8 months because I was just thinking about how long I've seen you guys kind of posting pictures and stuff. But so I mean, under a year, honestly, they probably do need some degree of that soothing that can come from a pacifier. Mm-hmm. But as long as it's not like they sleep with it in all night, they have it in constantly throughout the day, I think they'll be okay.
Mm-hmm. Yeah. Well, it's interesting too, because when we take it out, or if we see them sleeping, if I see them sleeping, and if one of them happens to have their mouth open a little bit, I'll try to close their mouth, and it's like when they go to sleep, it's like, oh man, this is amazing. But if their mouth opens again, I'll try to shut it again, and then it becomes like this back and forth, and their mouth doesn't stay closed. So how do we do that?
I know it's so tricky, and babies are not my area of expertise, but I know some great resources that I think anybody should look into. And I don't know, have you guys ever heard of Tummy Time by I think Michelle Emanuel is the woman who teaches it, but it's the benefits that babies get from being able to be put on their tummies and stretch up and use, it's like a skill that they need. So I would say, I mean, that's super important, tummy time. Baby-led weaning is a big thing for oral development. It's basically getting babies to not just eat pureed food, to get the benefit of being able to move food around in their mouth and use their muscles. And I think all of that, like, other than sleeping, if they're using their muscles, if they're able to learn to, move their mouth, manipulate food, that will help overall. But I mean, it is hard when they're asleep. All you can really do is just pinch their little lips together and hope they stay, or put the chin up, kind of push on the chin, make it close. It's good if you can do that. But I think what can help otherwise are some of these other modalities.
That's interesting. I'd heard of the tummy time, but I'd never really heard of because I've heard also too that it's not good to wean them off if they like too soon, because that has an issue with with the facial structure too. Is that right?
Totally. Yeah. And I mean, it's so hard because we live in like a modern world now, and a lot
Mm.
of women work. And, for whatever reason, sometimes women don't want to breastfeed. But I mean, it's really so good. I mean, before we had pacifiers, when it was just mothers and babies, and I don't know, it was like ancient times or maybe a few hundred years ago, nursing would have been the pacifier, the soother, for the baby. So, it's just we live in a different world now, so that's not always possible. But yeah, the longer the better. And if they can transition to even just like the coordination that comes from putting their own food into their mouth, like it's really crazy to see these baby-led weaning people. They give their kid like a drumstick, like a chicken wing or something, and they're just gumming it. They're just gnawing away, and they're not
Right.
really eating it for nutrition, but they're getting all the benefits of the hand-eye coordination, the fine motor skills, the ability to move food around in their mouth, like I said before. And it's really, I think, it's an amazing movement that I think is doing very good things. Probably what people have always done,
Hmm.
before we had like blenders and stuff to puree food and Gerber and all that.
Right,
So,
right, right. So
mhm.
in your opinion, what are some of the benefits and sort of drawbacks of what you were talking about before, which is where you rest your tongue in your mouth, if it's on the bottom or if it's on the top of the roof of your mouth? Let's talk a little bit about how that plays a role in the work that you do.
Yeah. Well, the tongue has to be in the palate for optimal jaw development, like I was saying in the very beginning. So if your tongue is down, your face is more likely to be long, narrow, your mandible is more likely to be set back, you're more likely to have kind of flatter facial features. So the interesting thing that is where my field kind of intersects with, you know, facial aesthetics and beauty and appearance is,
Hmm.
if your mouth is closed, your tongue is up, you're breathing through your nose, and you grow into an adult doing that, you will be, more attractive as an adult. And if we
Hmm.
look at a lot of the celebrities who have, they're considered to be beautiful, handsome, attractive, they have really good facial and jaw development. So, I mean, like look at like Heidi Klum or
Hmm.
I mean, really anyone, a lot of the models, men and women, we kind of look at facial features as being attractive if they're more well developed. So,
Hmm.
um, form and function go together. I honestly try not to focus on the appearance side of things. I'm much more focused on the health. But a lot of people find me because they're researching, like, why do I have a weak chin? Or why do I have, a narrow smile? Or why has my face grown down instead of forward? So
Hmm.
some people stumble across this stuff with kind of the cosmetic interest
Hmm.
and then learn, wow, this actually is more than just how I look. This is my health. So
Hmm.
that connects more with me.
Yeah, I hear you. You have a blog on your site, a recent one that's titled "Is it too late for me to start myofunctional therapy?" And I'm curious with you and with adults that are listening, what can we do, on a regular basis to, start working in this way? Do you think?
Yeah, I mean, first develop awareness. So many people, I can look at them and I will know right off the bat, they breathe through their mouth, their tongue is low. And if I ask them, a lot of times they'll say, I don't think so. I don't think I do that.
Mm-hmm.
I think my mouth is closed and my tongue is up. And these are not normal things to pay attention to. It takes a lot of awareness, and maybe somebody who's focused on their health is going to be, more likely to be able to think about that stuff. But some people get referred to me by their orthodontist or by their, ENT. And so they're not necessarily on a health search or like a health quest. They end up talking to me and they don't really know why. So the first thing I always say when I can see that people are in that situation is, really just think about your tongue. Can you try to get a visual idea of where it is? Like think about the tip of your tongue. Where does that rest? Think about the body of your tongue. Is that high, somewhere in the middle? Is it low in the bottom? Just start to build kind of an overall awareness of what's happening with your lips. Like, do they rest slightly apart? when I say open mouth posture or mouth breathing, it has kind of a negative connotation. You know, nobody really wants to say they're a mouth breather. That's kind of embarrassing. It's kind of an insult. So
Right.
most people are like myself. I mean, I was so embarrassed and horrified when I discovered that that was me, you know, and I was like, how did this happen to me? You know, so most people, once they realize it, then they're like, I've got to change this. Like, how did I get here? And wow, it's connected to all these bigger things. Like I need help, you know? So that's where that article kind of comes from. I get a lot of people commenting on my YouTube channel asking like, you know, I'm 21, is it too late for me? And I'm like, no, it's never too late to be healthier. It's never too late to, you know, change your habits. So, but yeah, start with awareness. That's the key. If you don't know that you have these habits, you can't change them. So,
yeah, I think a lot of us just kind of go throughout the day. We're going to go to the grocery store, we're going to go to the bank, and blah, blah, blah. We just kind of go throughout, and we just don't realize that our mouth has just been hanging open the whole time. You know?
Totally.
It's so crazy. Yeah, I think that's just kind of what happens. So, yeah, so awareness is really the key. And when I heard, you know, Carol a few years ago talk about the gases in your blood and how the pH of your blood can change by breathing through your mouth versus your nose, then it finally clicked that I need to start being aware. And ever since then, I've been more and more aware. But what I haven't done yet is the mouth taping. And I'm sure you're a big fan of that for when you sleep, right?
Yeah, I am. I am a big fan of it. Yeah, it's I use it as a tool. I don't think, you know, it's like the answer to all problems, but if you can start to tape your mouth during the day and, you know, really practice breathing through your nose while you're awake, and get good at it for, you know, while you're just kind of zoning out, like maybe you're watching TV or reading a book or looking at your phone or answering emails, something that doesn't involve talking or eating. You know, put some tape on your mouth and just see how easy that is for you. You know, if you're used to breathing through your nose, it should be fine. But for people who aren't, I don't recommend just putting tape on your mouth and trying to sleep. That's kind of like jumping from like 0 to 10, you know, it's like we've got to kind of take steps, you know, incrementally. And so I always tell people practice during the day, start with 5 or 10 minutes if that's all you can do. And then eventually work up to more and more time with the tape on your mouth. And then when you're ready, try sleeping at night with the tape. And the key is it's not just taping the lips to breathe through the nose. It's also working on tongue posture when you're asleep. So as you fall asleep, thinking about your tongue filling up and resting across the whole top of your mouth, that's the other component.
Yeah, that's so interesting. Yeah, because, you know, if you could modify and enhance, you know, the time when you're sleeping, and that's a third of your day, really. And
it's so much.
Yeah, it's.
I think, you know, I know you're into biohacking, and I am too. I can't call myself like a full-on biohacker, but I really think nasal breathing and, you know, switching from mouth to nasal breathing, it's like the ultimate biohack. I think I made a video on that a long time ago.
Oh, no way. I should watch that. That's cool.
Yeah, it's like the ultimate biohack is, you know, learning to breathe through your nose. If you don't do it, I mean, you can't get, you're not living in like your body's optimal state if you're mouth breathing on like so many levels. So even if it's only at night, and this is where people think, oh, it's nighttime, it doesn't matter, I can't control it. You will feel so much better if you tape your mouth at night and breathe through your nose the whole time you're asleep. You will wake up feeling like you had the best sleep of your life. It's really weird.
Now, what about for guys like me? I'm never clean shaven, and so are there tapes for guys like us? Do you know?
You can try. I mean, so I buy this tape. I have a piece. I have some right here. I tear off pieces that are like this big, and I don't recommend using a full piece. I usually cut this into thirds. But yeah, this brand. I mean, I just find it on Amazon. It's called Snore Less. It works pretty good. It's sticky enough to put it over facial hair. And I think, I mean, most men that I see as patients, they haven't had a problem. So
what's the name of that? I'm going to look that up.
It's Snore Less, SNORLESS. So there's no snore or no E on the snore.
SNORLESS. Okay, I'll put that in the show notes. That's
strips.
Cool.
Yeah. And I mean, it's I didn't invent this, I kind of wish like, oh, I wish I invented mouth taping, but no.
I
The
know, right?
mechanical breathing people, they've been doing it for like decades. So
Yeah.
it's just now become it's gotten a lot of mainstream attention, and it upsets a lot of people. It's really interesting. Like, I'm not sure if you know who Mike Mutzel is, but he does a podcast. It's called High Intensity Health. And he posted a picture of his daughter with a big piece of mouth tape, and she was asleep, and people were outraged, like, this is child abuse, this is horrible, like this should be taken down off Facebook. I think his post got removed.
Really?
And yeah, people get really upset. So I'm always like, with kids, I don't force the issue. If parents feel like it's weird or uncomfortable, and I would never recommend just jump straight to night. That's something that people can do on their own time. But working with me, I always want, especially with kids, get good at using it during the day, where kids can have tape on their mouth and nasal breathe for an hour, then try the nighttime.
Yeah, that's a good way to ease into that. I have a bunch of questions, and I want to talk with you about posture and everything else, but I'd be remiss if I didn't ask some questions.
I sent you an email of that deep frontline thing. I just did a quick Google search during the commercial and sent it to you. And yeah, so you can kind of see that picture that I'm talking about with if you scroll down on that web page, that has the dissection of the deep front line.
Cool. Let me try to find that. So that is the that's what you were talking about before, right? With the tongue?
Yeah, with the tongue connected to so many other things in this chain called the deep front line. And anatomy trained is really interesting, the way that they are looking at the body. It's not the traditional way of, kind of looking at the muscles and the fascia and the skin as really separate entities. They're so connected. And I think fascia is something we just don't fully understand. And going back to tongue ties, people who are tongue tied, they have a lot of tight fascia and a lot of restrictions in their head and neck, which of course are going to cause problems in other places too. Yeah, scroll down a little further.
Yeah, this is fascinating.
Down. Mm-hmm. And then it's that picture right there.
Interesting.
So the tongue is at the top.
Whoa.
Yeah, isn't that crazy?
Wow, that's crazy. So those are the lungs. So that goes all the way down to flexor. I don't even know, what is that at the bottom of your feet?
I don't know what those are. I mean, maybe the like tendons or muscles that run across the top of your feet, or
My goodness.
So yeah, it's really interesting, and it's pretty cool. I mean, it really is. Like, when you can see it like that, then you think, wow, that's kind of a big deal. So
all these pictures of like hands and stuff, is this kind of showing the tendons that are tied to the tongue?
I think it's showing. I'm not really sure. I just found that website really quickly. I think it's showing everything connected to the deep front line.
Isn't that fascinating? Going all the way down to the feet. Look at that.
Mm-hmm. And it's really through fascia. Yeah, so that's kind of I guess, an up close picture. But yeah, it's really strange. I mean, when people have their tongue ties released, at first, I mean, I've never had it done personally, but when you just hear stories over and over again and they're all kind of weird, you just start to think, okay, well, it's not just like one crazy person. People always talk about how when they have their tongue tie released, they feel like they can take a deeper breath. They feel like it's easier to have good posture. Some people feel like they have like warm tingling sensations that kind of overcome their body, like strange stuff that you think, how can like releasing that freedom cause such big things for people, like emotional releases, all sorts of things.
Wow.
I know that body workers will tell you, for people when they have knots and really bound up parts of their body, when they work on people in those areas, people can like have spontaneous laughter or crying, or and I don't understand that necessarily, other than emotions and traumas and stuff can be stored on some level in our bodies in different places. I don't know if that's a mainstream concept,
Right,
but
right.
I hear lots of even physical therapists. I mean, definitely massage therapists, but I hear people talking about that, and I feel like the tongue is a really like central part of our head, neck. I mean, it kind of is the center of everything with this part of our body. So I don't know what's going on, but I think we have a lot more to learn. That's for sure.
Yeah, I agree. So you mentioned before when it comes to tongue ties, the correlation between the MTHFR. Do we know like the real cause? Like, is MTHFR causing that, or is that an association in your opinion, or do you have any ideas?
It's an association, and it's really complicated. I mean, I don't even think the scientists fully understand what's happening with like epigenetics and stuff like that. But we do see in modern westernized, societies, a lot more of these epigenetic changes that come with, I guess, changes to our diet, changes to our air quality, stuff like that. So tongue ties are considered one of those things. I'm not sure if you're familiar with the book Dirty Genes or Dr. Ben Lynch. He's like the MTHFR expert. And he talks a lot about how these environmental factors are influencing the way our genes are expressing. And he does such a good job explaining it all. And I'm definitely not an expert on the genetic side of things, but we know that tongue ties are associated with that MTHFR gene mutation. But a lot of things are, autism, scoliosis, autoimmune issues. So that, I mean, it's kind of like a Pandora's box, so
yeah.
It's complicated, but we're seeing more and more tongue ties than ever before. And there's a few theories on why that is. Some people say it's because now we're looking closer, so we're finding more. I don't believe that. I kind of tend to agree with the people that say that our bodies are changing, because of epigenetic mutations and changes that can happen in one generation. This isn't like humans are evolving. This is, the factors that are in our environment are influencing the way our genes express.
Yeah. It's so fascinating. Sarah, do you want to take a handful of questions from the chat room?
Yeah, sure.
Okay.
Let's do it.
Okay, cool. Let me read off a few. I'm just going to start, you guys, from the top, and we'll tackle as many as we possibly can, and we'll kind of go through. And if neither of us know the answers, then there's always Google. But let's see here. Okay, so Mars Hutch says, I snore through my nose even when I'm on my side. That's a good question.
Yeah, and this is, it comes down to those structures. So, I mean, I would ask first, if you are my patient, do you think you breathe through your mouth during the day? Were you a kid with breathing issues? Or I would look to see if they're tongue-tied. And all of those can influence snoring. So even if your mouth is closed, if you've got kind of a smaller mandible or a narrower palate, and your tongue is falling back into your airway, that can happen even if your mouth is closed. You can kind of snore through your nose.
Right. Okay, so let's see here. A couple other questions. Nighttime nasal collapse. Okay, that was Mars. Okay, what about black bubbles? Here we go. I love the names on YouTube. This is great. Black bubbles. He wants to know about sleep paralysis. Is that even in your realm at all?
Well, I mean, so there's this umbrella term of sleep disordered breathing, and I don't know if that falls under it, but I know that sleepwalking and insomnia do fall under that category. So
really?
We tend to focus on obstructive sleep apnea, upper airway resistance syndrome, and snoring. Those are kind of the main ones that I deal with. But once in a while, I do meet people. Like I have one patient right now who he's an adult and he sleepwalks and he injures himself. And he also has like other things with sleep apnea going on. And that's the first time I've heard of that in an adult. But I mean, there is some overlap definitely with insomnia. So I don't know if sleep paralysis is in that, if it's considered a sleep disordered breathing, but maybe.
I know.
Restless leg syndrome is.
Oh, yeah. Is that right? Really?
Yeah, it is.
Wow.
So who knows?
Yeah, it's interesting. When it comes to sleep, it's like you're so close. I don't know what your spiritual beliefs are, but you're so close to. It's almost like a baby who's just come in, or like you're someone who's close to death. It's like you're so close to the other side, kind of, when you're sleeping. So I wonder if there's like
you're like in between worlds.
Yeah, I wonder if there's something like a recall healing or something might look into that.
Mhm.
Okay, so Joe Mama, this might be outside of your range as well. We've done a couple shows on fluoride. Do you have any thoughts on fluoride, or is that sort of outside of your realm of study?
I'm so conflicted on it. I honestly, I have a very traditional dental education that says fluoride is great. We need it. I know the benefits of it, at least from my schooling and my education, but I'm always, learning all the time that there's different opinions out there. There's other stances, and I haven't done my research enough to understand, what the anti-fluoride discussion fully is. I mean, I know that probably ingesting it is not good. I've heard a lot of things with like full body effects of fluoride. I know that too much fluoride on your teeth can cause problems.
Hmm.
But I mean, I wish I had a better, like maybe holistic dental perspective on it. But I only know what I was taught in school, and
Hmm.
I haven't spent that much time reading about it. But um, yeah, I'd love to know your thoughts.
Yeah, well, it's interesting because we go to a holistic dentist, Dr. Stuart Nunley, out in Texas, and he doesn't have any fluoride in his practice. And there's a really good video if you really want to get into like the biophysics of what fluoride does. If you go on YouTube and you type in
Yeah.
Dr. Jack Cruz, he's a neurosurgeon, and he
Oh,
talks.
I know him. Yeah.
Yeah,
Or
and
I don't know him personally, but yeah,
yeah,
I know his work.
he's got an amazing like hour-long talk on fluoride that'll just blow your
Oh,
mind. So
fluoride. Okay.
yeah, it's
Yeah,
fascinating.
I mean, it's the same thing with root canals and cavitations and those things that you're mentioning earlier. These aren't something that as a hygienist I was ever exposed to or taught anything about. So I feel like people who've gone down the holistic dentistry path, they've done a lot of outside learning on their own, kind of like I have with myofunctional therapy. Like I didn't
Mm.
learn any of this in my traditional dental training. So, I mean, I try to just keep an open mind and realize, there's probably a lot more out there than, what we think we know. So I try to just, learn as much as I can and try to make the best decisions. But sometimes I don't know, like I haven't been using fluoride in my toothpaste for a couple of years.
Hmm.
And I'm like, well, I don't know if that's good or bad, but I just feel like
Right,
maybe I shouldn't.
right.
So,
Yeah. Hey, here's a question we got from, this is a good one from, I think, Ivy Parsons in the chat room. And he or she says, if you use a CPAP machine, would it be better to use a nose only mask or a full mask to help retain nose breathing? That's a good question.
yeah, and it's so different for every person because CPAP machines, I mean, they're hard. I think the compliance rates on those are so low that I would say I tell my patients like wear whatever type of mask is most comfortable for you and that you can wear through the night because CPAP machines they do save people's lives. So I don't want to say like, oh, CPAP machines, you shouldn't wear those. They're not actually addressing a root cause. They're just basically keeping people breathing at night. So anybody who's on a CPAP machine probably also needs myofunctional therapy. So that's something to think about. But yeah, as far as using the nasal mask versus the full face mask, I have had patients who will use the nasal one and then tape their mouth. I've also had people tell me, and I don't know from personal, like I've never used a CPAP machine, that sometimes it's incredibly uncomfortable to breathe through your mouth because of the way the machines work. So
Oh,
I have a
interesting.
feeling that's probably case by, depending on the machine, there's a lot of variation in CPAP machines too. There's
Okay.
some kind of like base models, and then there's some very sophisticated fancy ones. So
Yeah.
yeah, it's hard to answer that.
Yeah, no, it is because like you said, it does save people's lives, but it doesn't get to the root cause of anything, but it does save
No.
lives. So,
Yeah, yeah. So, I mean, I see the benefits of it, but I also am like, this is just a good example of treating symptoms and not root causes. And
hmm.
we don't really have, other than prevention, there is no way of treating a root cause with sleep apnea without like surgery or a CPAP machine. Or,
Hmm.
I mean, the surgeries they do for CPAP are just, they're pretty brutal, or not CPAP, for sleep apnea, they're pretty brutal what they do. And
Wow.
it doesn't give people a lot of choices, you know?
Yeah, I hear you. I hear you. All right, let's take a couple more that I see that are pretty good. She's one question that comes in says breath work. Do you have a correct way to breathe? I was told in the past to breathe with lungs and diaphragm. Looking into the Wim Hof breathing, he says to breathe with the stomach. What is your opinion?
I really like the Wim Hof breathing. I've done it. I just feel like it's, at least in my opinion, and I tend to side with Patrick McKeown on this. He has a really good article on his website talking about his breathing technique through Buteyko breathing, which is almost in a lot of ways the exact opposite of the Wim Hof method. So I feel like I use both. I think Wim Hof is a good thing to do like short term if you just need to kind of break a stress pattern, or, you know, I don't think you should be breathing like that all day, I guess. Where, you know, it's kind of like you're putting yourself into hyperventilation, but Patrick McKeown and the Buteyko breathing people say that, you know, hyperventilation is bad. We are all over breathing. We need to breathe less. So I see benefits of both, but I don't have an answer. I mean, to me, as long as you're breathing through your nose, I think this is the key. You know, in through the nose, out through the nose. Even in like a lot of yoga classes, they say in through the nose, out through the mouth. I don't do that. I'm like nose only.
Yeah.
But you know,
That's so funny.
I think we have to find kind of what's comfortable for each of us too. So I mean, if you really get a lot of benefits from the Wim Hof stuff, then do that. I don't know. Look up that article though. I mean,
isn't Wim Hof, is it my understanding that Wim Hof's breathing method, like you said, is more for short term? It's more to like get yourself out of a stress. Like if you're going to jump in some cold water or something like that,
exactly.
Right?
That's what it's for. But I do think people use it as like probably, I mean, too much. If you're putting yourself in that hyperventilation all the time, you're in some ways you're initiating that sympathetic response, and you're kind of putting yourself into that. I feel like when I've done it, it starts off that way and then it gets into like very like relaxed parasympathetic state. But it's definitely like that lightheaded, tingly body, you know, like feeling.
It's like that. I used to do that breath of fire when I did meditation sometimes, and that's like a lot of that really short breathing and like in and out really quickly, right? Yeah.
So, I mean, it's so hard to know. There's so many different opinions and thoughts on this. What I can tell you for sure is that, you know, you have to breathe using your diaphragm. I think one of the things that has helped me more than anything with understanding like our diaphragm is so much more than our belly. We tend to think like, oh, belly breathing, deep breathing. If you can learn how to breathe and expand your rib cage, like feel the ribs expand, like if you put your hands on your rib cage, if you can hold and feel, like expand your ribs and feel like fully filling up like through your belly and your rib cage, get that type of deep breath. If you can engage that, it's a good practice to be able to feel that. Most of us, our rib cages are pretty compressed and collapsed. So that's not really myofunctional therapy, but I talk about it a lot.
That makes sense. A final question from Big Fat Mama in the chat room. That's great. That's so funny. Sarah's opinion on hydrogen peroxide for brushing. It's an antibiotic that kills good and bad bacteria in the mouth. Do you think it's good or do you think it's not so good?
Oh, you know, I'm really not sure. Again, like I hear, you know, so many things in the back of my mind from my traditional dental training that's like, oh yeah, just, you know, rinse with whatever. But then I do think about the oral microbiome. I don't think it's a good idea to wipe that stuff out with like Listerine and stuff. I'm not sure where hydrogen peroxide falls on that. You know, I don't know if that's going to kill too many of the good bacteria alongside of the bad bacteria. I think the best way to kind of get your oral hygiene back on track is manual scaling from a hygienist. That like clears out so much of that bacteria. It gives you a good like start. And then from that point forward, as long as you brush and floss and, you know, take good care of your teeth, the bacteria should all stay in you know, the correct levels.
Yeah, there's a ton of questions in the chat room, but we just can't get to all of them. But I wanted to sort of end on one question I was curious about, just on a personal level, because as a child, I used to stutter quite a bit, and I used to go to a speech therapist and actually have sessions with her to fix this. Is stuttering, do you think, in children related to all this kind of work that you're doing? Do you think there's a correlation?
I don't know.
Seems like there would be.
Stutters are really interesting. They kind of baffle even speech pathologists, and that's kind of their realm. We don't always know if it's more of a mental emotional thing or if it's more of a like physical muscle thing that has to do with like, production of sound. So I don't know. I've heard people connecting tongue ties and stutters and like late speaking with myofunctional issues. Sometimes kids who stutter, they're later speakers. I don't know if you know about yourself, but that's kind of me, that's just me kind of guessing. I don't have any background on like knowing for sure what the connection is with that.
Yeah, it seems like there'd have to be something like emotional, spiritual, and psychological going on with the inability to speak, and then also anatomical as well, maybe. But it's a hard one, isn't it?
I definitely, it is hard, and I don't think, it's just not something we fully understand in the medical dental world or speech world either. So. But yeah, that's a good question. I always wonder stuff like that. Like, what is the root cause of so many things that we just kind of like treat the symptoms of? I don't know.
Right. Yeah, it's fascinating. So tell people a little bit about what you do if people want to work with you, because you're telling me before the show that you do see people, right, via Skype and things?
Yeah, so I started my practice in 2010, and I was in Seattle, and that's where I was living, and I would see people in person there. And then things just grew and changed over the years. And so since 2014, I've been seeing my patients exclusively online. So I do telehealth or telemedicine. And you can get in touch if you want to do a free assessment. I offer those. Check out my website, YouTube channel. I do have a lot of content I try to put out to get people this information, because you can't necessarily go to your pediatrician or your general physician or your orthodontist or dentist and ask this stuff. Most dentists and doctors have never heard of myofunctional therapy. They don't know how to answer your questions if you're worried about your tongue posture or mouth breathing. So that's a problem. And so I've just tried to make my website and my YouTube channel a resource for people. And I think it's helping. I like to think so.
Yeah.
And then if you are a dentist or a dental hygienist listening to this, I do mentoring and training for healthcare professionals. I've had a couple physical therapists take my course, but it's mostly dental oriented. But I do training. I do like a mentoring program for people who want to learn how to integrate this into their existing dental office, or for hygienists who want to become myofunctional therapists. I help with that too. So kind of got a couple things going on.
That's interesting. So if someone wanted to find out whether or not their dental office knows anything about myofunctional, could they just call up and ask, or is there a resource for finding those
you'll probably,
dentists?
It's very rare.
Yeah.
If you ask your dentist or somebody at the front office when you call, they'll be like, what are you talking about? And they'll be really confused. So.
Right. That's so funny. But there's got to be a website, because I know acam.org is kind of a natural website where you can find practitioners. But I wonder if myofunctional therapy is on a website like ACAM. I've never looked.
There's a few different training organizations, and the thing is, we don't have any like true licensure. You have to be a healthcare provider, but you can be a hygienist like me, you can be a speech pathologist, you can be a massage therapist, you can be a psychologist, a nurse, a lactation consultant. You can basically have any healthcare background and get additional training in this, but it's not a standalone field like, dental hygiene. Like I had to take board exams and I have to get a license through the state where I practice. This isn't really like that. So there are some private training organizations, and they'll have their own lists of people they've trained. One's the International Association of Oral Facial Biology. It's a mouthful.
Wow.
And then there's the Academy of Applied Myofunctional Sciences and the Academy of Orofacial Myofunctional Therapy. So
Oh my goodness. Jeez. Wow.
I'll write that out for you.
Yeah. Wow. Yeah. Are those all linked to from your website?
I don't think those are on my website, but
Okay.
yeah, I can give you those links, and help people, find kind of the organizations that are in charge of. There's a couple, but the organizations that are in charge of this field. It's a really interesting field, and I think it's an interesting time to be in it because it's kind of like, I mean, it's kind of the Wild West.
Right.
We right now at this point, the training is focused on healthcare providers, but this field doesn't belong to any industry or any field. So I almost feel like it could go anywhere. Like maybe eventually this will be integrated into dental school or dental hygiene school curriculums.
Mm-hmm.
Maybe it'll be integrated at some point into speech pathology, but with so many people coming from so many different backgrounds, I don't know how it's going to play out in the long term with like, who does this field belong to, I guess.
Yeah, it's also fascinating. So if people want to connect with you, is your website the best way? It's myfaceology.com?
Yeah, myfaceology.com. And then my other website is myomentor.com.
Myomentor. Okay, cool. Well,
Yeah,
Sarah,
and
thanks.
that's more for the professionals.
More for them to get training. Well, Sarah,
Yeah.
thanks so much for being on. That was so much fun, and this field is so fascinating to me. And now I'm going to start looking at people's faces in a whole different way.
Yeah, definitely. I'm happy to talk about this stuff. So, anytime. And if you have questions about your boys, then let me know. I'm happy to try to help with that too.
Oh, that's so cool. Thanks so much, Sarah. And I'll be in touch on email when this goes live.
All right, sounds good.
Awesome. Thanks, Sarah. Bye-bye.
Thank you. Bye.
All right, there you go. Sarah Hornsby from myfaceology.com. And, it's fascinating. It's fascinating stuff when you start looking at the interconnectedness of all this stuff. Because I was thinking about when she was talking, how there is such a connectedness. Like if you think about, this is what's really strange about the mouth and the oral health and all of this. So on one level, you have like the tongue, like she was talking about, right? Where it's connected to all the way down to the fascia in your feet. So you have this interconnectedness going on there. And then you have the gases in your blood changing, the microbiome in your mouth changing, and the pH of your blood changing. All these things are happening, right? From the structural components of what's going on. Then on top of that, you have dental issues, right? So you have like cavitations and things. So there's the actual oral health of your mouth going on, and you got to make sure that you don't have cavitations and how. And then on the third layer, on top of that, you have the Chinese meridian system going from specific tooths to particular organs in your body. So you have like dentists now taking pictures. I think Stephen Hines is one. He's not a dentist, but Stephen Hines is one. And who's the other guy we had on? He has a website called breastcancercured.com. I forget what his name was. Dr. Bob Dowling. And he was showing x-rays of, a line going from someone's infected root canal all the way to the tumor in her breast. And so you have this weird Chinese meridian system going on. And then you have oral pathology affecting thyroid health. Because if you think about the lymph system, it's going to, all of your organisms that are in your mouth are going to drain right to your thyroid. So you have thyroid health as, sort of as a downstream from where all those toxins kind of migrate out of the mouth through your lymph system right onto your thyroid. And then, you have recall healing on top of all of this when it comes to like sleep issues. And so it's all so interesting and so beautifully connected in such strange ways, right? Like how is all this stuff completely connected? I don't think we really even know yet. And so one of the cool things though that I like about and what she talked about was the mouth tape and the mouth breathing. And I'm just a big fan of utilizing that time that you're sleeping to optimize it to the best of your ability. And if you could do it through mouth tape, if you could do it through, creating a Faraday cage and sleeping and improving your sleep, because that's huge. All of the stuff is super, super huge. One of the ways I like to do that is a Magnetico mattress pad. If you guys are listening or watching on YouTube, you can see a picture of it here. It's a pad that you put on your bed, and what's fascinating about it is that there's over 1,200 magnets that go on your bed, and we have one. There's 3 different sort of strengths. One is the 5 Gauss, one is the 10 Gauss, and one is the 20 Gauss system. The Earth's magnetic field, as we know it now, the flux of the Earth is, I think, around 0.5 Gauss. So a 20 Gauss is going to be like 40 times stronger than what we're being exposed to on the Earth right now. And magnetism is incredibly beneficial. Let me bring up a little clip here from our good friend, Dr. William Pollack, and listen to what he has to say about magnetism. It's pretty fascinating.
The body, and for the body.
Okay.
All the activity of the body, all those biochemical processes rely on the natural electromagnetic fields and electrical fields within the body itself.
Okay.
Magnetic fields drive chemical reactions.
Okay.
Chemical reactions interact with magnetic fields, so they go back and forth.
Okay.
Again, it's very dynamic. But because the magnetic field doesn't stay in the body doesn't have to process a magnetic field the way it processes a chemical or a food.
Okay.
Okay? And it's going all the way through. And as it goes through, it does a bunch of different things. And in the book, I actually have about 25 different mechanisms that I describe about how magnetic fields actually work in the body.
Interesting. Okay.
But the primary mechanism we believe that's happening is that you're generating charge. You're generating energy, the production of energy in the tissues. And remember I said electric currents and magnetic fields in the body itself drive and move all sorts of processes continually.
Okay.
And when you have disease, when you have illness, when things are not functioning as well as you want, and including aging, the slowing down of activity in the body, that is due to a decreasing energy production processes in the body. That's what aging is. It's the reduction of energy in the body.
Mm-hmm. Yeah, and this is what's really cool about the magnetic sleep pad is that this is something like a magnetic sleep pad that you can put on your bed, and it's really challenging to get it on your bed because, like I said, there's like 1,200 or 2,000 magnets on this thing, and it weighs like almost 100 pounds. But it's really, really cool when you sleep on it, and our kids have been sleeping on this for, since Kate's been pregnant. In fact, here's a picture of Kate when we first got ours. She was pregnant then. When we first got them, and there she is, and we're just installing our 10 Gauss magnetic mattress pad there. And it's just an awesome, awesome technology. And we did a whole show with Dr. Dean Bondley on the technology about all this, and a big, big fan of it. We use it every single day. So if you guys are interested in benefiting from sleeping in a magnetic field and possibly having an impact on 5G and wireless radiation and dirty electricity in your walls, this is really, really something to think about and consider. So if you want to use the code EHR10 on a Magnetico, check that out and go through our link, and then when you make a purchase, use the code EHR10. That will save you 10% on your order. So I just wanted to let you guys know about that. Big fan of Magnetico, Dr. Dean Bondley, and what he's doing there at the Magnetico company. And also, I wanted to tell you, too, about one of my favorite little devices that I use every day, and that's the Relax Far Infrared Sauna. And let me bring it up here so you guys can take a look at it. Sauna therapy has been used, guys, for like thousands and thousands of years. But what's really cool about this this sauna that we use is that your head sticks out of it. And that, to me, is one of the biggest kind of things I think is important, because from an Ayurvedic perspective, it's not good to heat up your head. I don't know why, but that's a system, a healing system that's been around for like 4,000 years. But I'm a big fan of this one, and I use it just about every day now, back on it, and watch documentaries. My head sticks out. It's really a tremendous thing, using far infrared light to penetrate all the way down to the bones. And what it does is sort of oscillates your fat cells to detoxify chemicals, heavy metals, things like that. And let me play a little clip from, this is a little clip from our doctor, Stuart Nunley, and he's our dentist, who I mentioned before. Really an amazing guy. Listen to what he had to say about his story with this.
You know what I chose to do? I chose to go very, very slow as I detox. So one of the things that I did is I invested in an infrared sauna, which was huge. That was a big, big part of my healing because, interestingly enough, many times patients who have heavy metal toxicity lose the ability to sweat. And so I was one of those. I could not break a sweat. And the infrared sauna helped me to retrain my body to be able to sweat. It was a huge part of my overall detox.
Doesn't Dr. Huggins say as long as there's more going out than what's coming in, you're okay?
Absolutely. Yeah, and I think he's right. I think he's absolutely right on that.
I think so too. I'm a big fan of sweating every single day, especially living in this culture, living in this crazy world where we have, being exposed to chemicals. Over 60,000 new chemicals have been introduced in our environment since the early 1960s. 60,000 new chemicals. So it's absolutely imperative that we're doing stuff on a daily basis. And here's a little clip from Dr. Christopher Shade talking about sauna therapy as well.
How do I detoxify from plastics? I mean, you guys are using a sauna, and that's something I'd like to get. And what does a sauna do for us? A sauna is great. It's moving a number of different toxins. Remember, we talked about the mice, that if you put PCBs in there, then that made the mercury all that much worse. And sweating moves out a lot of plastics, volatiles, fat-based toxins. It's really good at moving those out and sweating those out. So that's how you're getting those out, and those are contributing to this synergistic soup inside the body. And so that's why they're good, is they're taking out a bunch of the different things in the soup.
Yeah, my friend. So make sure to consider getting one of these relaxed saunas and Magnetico if you really want to bring some of these healing tools into your home. Great investments, and we like standing by good companies doing good things. We've done a number of different shows on sauna therapy, so if you guys want to check those out, feel free to do that. What did you guys think about... Heard you guys are chit-chatting in the chat room. That's awesome. You're an Animal says 1 parts per million of fluoride can cause health complication, if I'm not mistaken. Yeah, Shadowrunner says, check out the Fluoride Deception. It was a scam from day one to get rid of industrial waste. Yes, I haven't seen that movie. I should watch that. I've heard about it, the Fluoride Deception. We did a whole show with Dr. Tim Kennedy, or I forget what his name was, years ago, on all about fluoride. The whole show, like an hour and a half, we did just on fluoride. And so it's interesting, though, because, obviously with Sarah, that's not her area of expertise. And, she's spending time working with people and studying, things in her field. And so a lot of these things, questions for guests, if they're not in their specific area of expertise, then they're not going to really know too much about it, I wouldn't imagine. So anyway, I hope you guys enjoyed that show. This was episode, let me make sure I get this correct here. Episode 657. So if you guys want to catch the show notes, I tried to take some good notes for you on most of the things. So also, you guys too, if you're watching on YouTube, make sure to subscribe to this channel, because we're going to do shows, or we are doing shows 3 times a week. But also make sure to subscribe to us on iTunes. So on iTunes, we're doing a show a day. So what's really cool is that we're doing 2 to 3 new shows, probably about 2 shows per week that are new shows. And then the other 5 days, we're releasing our older best of content that you guys maybe have never heard of before, since we have 657 shows. So make sure to subscribe on iTunes. There's a link down below if you guys want to check that out. Love you guys very, very much. Great to see you all here. It's great to be back, actually. And part of everything here, again, is, taking a week off is, I didn't want to do it, but I felt like it was necessary, not to overdo it. So Paulette, great to have you here. Big Fat Mama. Nicholas Gasvig is here. Mark, great to have you here as well. See your name a lot. Tina Ramsden is here. Lots of cool people, lots of good folks. Ivy Parsons. So really, really happy you guys are here. Awesome stuff. So make sure to subscribe, and we're going to be having another cool show this Friday. If you guys want to check it out, that's going to be, let me make sure I bring that up. Who's that going to be? That's going to be Dr. Judy Mikovits. We'll be talking about cannabis, so that'll be a good show. So make sure to subscribe. All right, guys, love you very, very much. You are amazing. Thank you for being here. Make sure to subscribe, and I'll see you on the next episode.
No material on this blog is intended to suggest that you should not seek professional medical care. Always work with qualified medical professionals, even if you educate yourself in the field of live food, nutrition, and alternative medicine. I'm not a doctor, nor am I offering readers medical advice of any kind. None of the information offered here should be interpreted as a diagnosis of any disease, nor an attempt to treat or prevent any disease or condition. While information in this blog is discussed in the context of numerous conditions, it can be dangerous to take action based on any information in this blog or to start any health program without first consulting a health professional. The content found here is for informational purposes only and is in no way intended as medical advice, as a substitute for medical counseling, or as a treatment/cure for any disease or health condition, and nor should it be continued as such. Always work with a qualified healthcare professional before making any changes to your diet, prescription drug use, lifestyle, or exercise activities. This information is provided as is, and the reader/viewer assumes all risks from the use, non-use, or misuse